I now am going to introduce our next guest, Andrew Slavitt. Mr. Slavitt is the Chief Executive Officer of the Optimum Insight, one of the largest health information technology and consulting companies. Welcome, Mr. Slavitt. Has held executive positions with several other healthcare companies. He also worked at McKinsey & Company and Goldman Sachs. Welcome, and you have 5 minutes, and we will be lenient with you as well.
Thank you, Madam Chair, Ranking Member Richmond, members of the subcommittee, for the opportunity to testify today on the barriers faced by small group physicians and single physician professionals in adopting and implementing health information technology. My name is Andy Slavitt. I'm the CEO of Optimum Insight, and we're one of the world's largest health information technology companies with about 14,000 people worldwide. And we've worked with thousands of physicians to help them implement health information technology and help them overcome their greatest concerns: cost, uncertainty, and complexity. We've learned a lot about what works. Help doctors make the complex simple, and you will see improvements in productivity and adoption. Resist the urge to support efforts, even tied to financial incentives, that do otherwise by adding complexity. It's not just technology adoption that's at stake. What's at stake is actually the very future of the solo practitioner in this country, where cost, complexity, and uncertainty are driving consolidation into hospitals. So to be adopted, technology must be the means of supporting the physician and the patient in something beneficial to them, and it can. Consider the example of how technology could help reduce unnecessary hospital admissions. A doctor may see 40 or so patients in a day. Data suggests that only a small handful of these patients will drive the majority of costs and potential hospitalizations if not treated. Without technology, every patient looks alike until the doctor walks into the exam room. As the doctor gives out orders for a prescription, lab test, a dietary restriction, those that go unfollowed are more likely to end up with a patient needlessly hospitalized. Without technology to help, doctors don't know who's complying and who isn't until the patient shows up in the hospital. Even then, data suggests that doctors only become aware of this about half the time. And without the technology to trigger a follow-up visit, the chances of a longer stay or a readmission go up. All of these changes require less information technology than is used by an airline reservation clerk. In communities where this sort of technology adoption is occurring, like Grand Junction, Colorado, there is evidence that unnecessary hospitalizations, which cost us $30 billion annually, may be dramatically reduced. So I would urge us to focus on these basic things which simplify a physician's life and add more productive time to their day before we focus on more abstract requirements. So what is it about technology that's creating these barriers? Physicians will point to several issues that have been brought up on this panel already: costs, legal uncertainty, and privacy regulations. But perhaps the greatest barrier is simpler than those. Productivity-enhancing capabilities that I described are not today driving the purchase and design of this technology. Ironically, in a world where cloud computing, mobile technology, and social networking are creating low-cost access to a variety of capabilities for individuals and small businesses, the typical physician may tell you that the technology in their office or hospital has often become a contributor to regulatory burdens they face. Whether meaningful use standards are right or wrong is not the real issue. What is important is that today the end users, doctors and patients, are further away from the actual product design because new product development is focused on satisfying those regulatory hurdles of a payer, CMS, rather than on simple innovations that improve productivity. The HITECH Act created important momentum. Approximately a third of office-based physicians are currently planning to achieve meaningful use of EHRs and apply for incentive payments this year. We need to consider that for the rest of the physician practices, the smaller ones, the temporary financial incentives will not be enough to compensate for productivity losses. And private sector innovation is at work to demonstrate the power of technology where meaningful use is just the starting point. Our company, Optimum Insight, offers technology, for example, with no upfront costs or maintenance required, no purchase of servers, automating the coding process for billing and collecting from health plans, and most importantly, is instantly updatable based on the needs of the user right from the cloud. The way the world is going, we believe technology should be free. Services should cost money. Technology is becoming more and more part of the fabric of our lives. Our written testimony offers 5 common-sense recommendations for Congress: align the requirements and regulations placed on physicians in the multitude of programs Congress oversees, Second, continue Federal investments in HIEs, which should be as essential to CMS as MMIS systems, which pay Medicaid claims and administer benefits. Third, reduce uncertainty over the legal environment. Fourth, provide SBA loans, guarantees for small and solo practices and other clinicians not eligible for Medicaid meaningful use incentives. We understand this to be budget neutral. Continue support for the regional extension centers you heard about in the first panel, which are proving to be a strong tool to provide expertise to small practices which lack resources. In conclusion, I applaud this subcommittee for focusing attention on this issue. Physicians who practice in small practices, who were once the cornerstone of health care in most communities, are already an endangered species. In the 10 years prior to 2007, the percentage of visits to physicians who were solo practitioners decreased 21%. The trend has only grown more severe since. Simplifying the environment for these practices and private sector innovation should be the goal, while supporting and improving upon the efforts that got underway with the HITECH Act. Thank you for the opportunity to testify.